So that was a good intro talk for the talk I'm going to do, another radio frequency device which has multiple settings and modalities, so it's got great versatility to use for multiple different applications. So microneedling's actually been around for thousands of years. There's evidence that the ancient Chinese doctors used it BC, but more recently in 1905 there was a German dermatologist who started using a manual microneedling device to treat different skin conditions. So as time's gone on, we've now got lots of different devices. We've got manual devices, mechanical devices, and now we have it with radio frequency, which Dr. Cook has just spoken about the benefits of that. So just going through the basics of how microneedling with radio frequency works. Obviously the microneedle tip is placed on the epidermis, and the needles then penetrate the tissue to different depths according to what setting you provide, and according to what condition you're treating, it will need to be at different depths. So then you use monopolar or bipolar radio frequency energy, which is transmitted through the needles and into the target area, and they work in different ways and reach different depths. This causes a conformational change in the collagen, and so it doesn't actually destroy the collagen, it just breaks down some of the links but preserves other links, so you get tightening and shrinkage of that collagen 3D helical structure. So it shortens, and that's how you get the tightening effect, but it does preserve some of the links, the cross-linking bonds in the structure, so that you don't kill the collagen, and you stimulate collagen production near collagenesis through this technique, because the wounds create, the needles create small little wounds, and then that stimulates the wound healing process, and the conformational change in the collagen structure also stimulates near collagenesis. Oops, I'll just go back. So this is just a picture of the device, and this is a particular type of attachment called the fusion tip, which goes onto the device that I've been using over the past year. And just some quick before and afters, and I'll get into how we reached this result. This was using a fusion tip to put hyaluronic acid, inject hyaluronic acid at the same time to achieve this result, and this was after one treatment. And again, the other side. So the benefit as well is that it treats active acne. That's not my intention. I'm not a dermatologist. I don't want to treat active acne. I'm only going to be treating acne scars, and this device can do that, and then with the added benefit of being able to inject topicals with it, you can achieve a lot more in a quicker time frame with less treatments. So conventional radio frequency microneedling traditionally uses bipolar radio frequency. So I think in the early days monopolar was used, but those machines were very, very bulky and very, very expensive and not particularly user-friendly and a bit dangerous. And now we have bipolar radio frequency, so the current passes between two electrodes, making it very safe and very restricted. You don't get the spread of heat, but you can only heat to a certain depth that's quite limited. It's not as deep as a monopolar treatment and not as broad. And we typically use insulated needles, which again is a safety thing. The energy is distributed at the very tip of the needle instead of all the way along, so it's a way to limit the heating effect and causing more damage to the tissues around it than you want to give. So this particular device that I've been using over the past year, which is called a Potenza, is an advanced radio frequency microneedling device, because it basically incorporates a lot of features that some of the best features of all of the devices that already exist, but it's in one device, and so it gives it great customizability and versatility, so you can really pick and choose exactly which elements you want to incorporate to treat different treatments. And it was useful in my practice because I don't want to have many different machines. I'm not planning on foraying into the world of laser and having lots of different devices. That's, you know, my non-surgical arm is just a small part of what I do, and the majority of my work is surgical. But I wanted to have a device that sort of treated a lot of different conditions that I get asked about by my patients, and certainly the facelift patients who are sort of on a journey. Sometimes they're not ready for their facelift, but they want a skin tightening procedure. They don't want any downtime. And this is a device that has so much versatility in it, treats so many different conditions, but it's one device, it's portable, it's mobile, it's user-friendly, but it's, because of the different features, it's got this level of complexity, which means that you can do a lot more with it. So those features are that it has monopolar radio frequency as well as the bipolar function. So then this obviously can reach a deeper level and treat more widely. And you have the tiger tip. So as well as the insulated needles, you have this tip which has got insulated and non-insulated sections on it. And so this allows you to treat multiple levels with one pass, but also the non-insulated components, because there's two of them and they're separated, it creates a smaller wound than if the whole thing was non-insulated, and it alternates it with an insulated part, so it's just less injury. It's causing coagulation at those two levels, but without causing that collateral damage around. So that's a benefit of that one. And then there's the fusion tip, which was what the photo was before. This is the tip that's used to deliver topicals. So you've got enhanced delivery of topicals with this particular tip. It's up to 68% more compared with just applying a topical straight to the skin. And this tip uses a pumping action, so it stamps the drug into the skin, but it delivers the radio frequency needling, and it sucks the product up and then re-delivers it in a pumping type action. And then finally, one of the great differences in this machine is impedance monitoring. And essentially, I mean, this is a really key important feature because the whole treatment isn't going to work if your impedance levels and your skin resistance isn't appropriate. And so radio frequency technology sort of relies on Ohm's law, where the amount of energy that's actually delivered to the tissue is dependent on the current that you're providing, as well as the resistance in the tissue. So it's really important that we know what the resistance level is, because if the resistance level is too low or too high, you can stamp away and you're not actually delivering the energy that you think you're delivering on the machine. You'll have the settings at whatever they may be, but if they're not actually being delivered to the tissue because the impedance or the resistance of the skin is, or the energy for that resistance isn't appropriate, then it's a wasted treatment essentially. And without that feature, you don't really know whether you're delivering it. So this machine has impedance monitoring. It will give you a number back that you know, okay, I need to be between this range and that range to know that the energy is actually being delivered to the tissue. And then it does micro adjustments as you go along, so that that energy that you've set is being delivered. And sometimes you have to change your technique and move your hand around and change the position of the skin, etc. But resistance can be affected by a lot of things, such as the patient's hydration levels, their collagen levels, whether they, have previously used skincare, things like that, heat, temperature, etc. So there's a lot of features that make it really, really much more, from what I know, and I don't have a lot of machines, but it's just that next level. It's a bit more advanced and you've got a bit more control. So yeah, it's got the monopolar and the bipolar radio frequency settings, which, as I said before, just gives you control over what level you want to target and the aggressiveness of your treatment, and you can treat different conditions using monopolar and bipolar based on which level you want to aim for. So with monopolar, obviously you've got a current which is being directed from the device to a grounding plate via the patient, and this allows you to give a deep and wide treatment. compared with bipolar, where the current passes between 2 electrodes, which is the 2 needles. So it's just a more focused treatment that doesn't create that widespread heating, but it's quite limited to the more superficial level because you can't get that projection down to the grounding pad. It says on there that it's sort of more aggressive. I don't know that it's necessarily more aggressive, it's more focused. So these are the results. So Dr. Singh was going to do this presentation, but she wasn't able to come, but she has some amazing results after just 1 treatment and 2 treatments, and she's got great photos where you can really see amazing decrease in this lady's fine lines and wrinkles. And I think the lifting effect around the jawline is pretty obvious. So yeah, it's pretty remarkable results. I mean, it's great for the lower neck as well, where lasers aren't really particularly effective on the neck. They cause a lot of wounding, and there's not a lot you can do about a neck unless you have a facelift, really, or a lower face and neck lift. So this is kind of for that intermediate step before people get to that stage, and hopefully they can prevent it if they get it early enough. So again, you can see the nasolabial folds. There's a huge improvement here. And just general skin tone and texture. So the tiger tip technology, this is the insulated and non-insulated tip that I was telling you about. Essentially, you can target 2 levels in 1 pass, whereas typically you'll do 2 passes if you're using an insulated tip. And you can oscillate between monopolar and bipolar, and it's 1 megahertz and 2 megahertz as well, so you can modify those settings. And again, that's just a picture of the collagen. So, yep, 2 horizontal areas of coagulation at different depths in a single pass. I've talked about all of this. This is the tip to use for deep tissue tightening. I don't know what this video is. Just another little... So this is the fusion tip, just showing you injecting. It goes up to 2.5 millimetres and delivers the product. So you can use topicals of your choice, I suppose. I've only done it with the skin booster, and that's how I did that acne result. And this is just a picture of how that works, a video of how that works on a patient with acne scarring. So you drop the drug on the surface and then essentially stamp it in, and you've got the benefit of radiofrequency with microneedling with your topical drug delivery as well. So it's a 3-pronged approach. And this is just a slide on the impedance monitoring, but essentially you've got your radiofrequency irradiation going into the skin, you have resistance coming back, and then this device can detect that using the real-time impedance monitoring technology, and it will make adjustments as you go along, which I discussed already. So it improves the efficacy of your treatment. As I said, without it, you actually don't know if you're delivering the energy at all, and on this device, you can use a standard setting or a manual setting, and standard settings for skin tightening, rosacea, acne, fine lines and wrinkles, etc. exist, but once you're quite au fait with the machine, you will want to use a manual setting where you can modify, you can change the skin depth, the delivery of energy, the time period that you're delivering it over. You can modify that for every part of the skin, which is what I think is really important, because obviously there's huge differences across the face and neck. So that's pretty much it. It's just a quick video of it in action, which we've seen, and more of the same. So yeah, so the Potenza is really an all-in-one device. Obviously there are some epidermal conditions which this is not necessarily the most appropriate for. As Dr. Cook said, you would still want to use your lasers and things for, you know, pigmentation and some epidermal conditions. But for all of these conditions, this is a fantastic machine. It's got so much versatility, and yeah, it's portable and it's super sort of user-friendly. It does require a little bit of knowledge of the science and physiology of skin to use it though, because it is just that next level. But yeah, it's been a great adjunct to my practice. Thank you.